It's gonna, okay, go ahead, Bailey.
Okay, well, welcome Monday morning or Monday afternoon meeting. Mr. Losi, would you like to lead us in the Pledge of Allegiance?
Absolutely. Ready? Please join me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you very much. Would anyone, new members, guests, like to introduce themselves today?
I think we all know Heck. Danny, hi Danny. Dr. Arcidi, did you want to give us a little bio?
I think I can't remember if it's on a slide or not, but no, yes, I'm the director of cardiac surgery at Providence St. Joseph Eureka, and became the medical director just back officially in January. And you'll hear about some of the good things we're doing. But I've been a cardiac surgeon for more than 25 years, almost 30 years now. And we live in the Pine Hill area. And we are actually very frequently in Ferndale, and I've certainly been to Fortuna already a number of times, and charming communities, both of them.
Great. Well, we're thrilled to have you, and thanks to Tom Hiller, who came in and recommended I reach out to you, and I see he's trying to connect on audio. So hello to Tom if he's there. Awesome. Great. Anybody else? I think we all know each other. Okay.
Cool. Well, I'll let Renee update us on chamber announcements.
Yes, we have quite a few. Okay, so as I mentioned in one of our previous meetings, there is a Redwood Coast Region Economic Summit coming up October 21st and 22nd. Tickets are now on sale. We will have Susan Seaman from the Arcata Economic Development Corporation as our guest speaker on the 27th of this month, and she will give us all the details on that event that's coming up. So watch our newsletter for more information on how to buy tickets. This Friday, the 17th at 12:30, we will be outside Sequoia Gas doing a ribbon cutting in celebration of their 80th anniversary. They will have an open house from 12 to 1, so people can stop by at any time and give their congratulations and well wishes if they want to, or be there at 12:30 and be in the photo. Our fall 2021 quarterly printed newsletter should be hitting mailboxes today, if it hasn't already hit your mailbox. Also, a haunted house is coming to Fortuna. I'm very excited to announce that. The young man who's putting it together is named Griffin Locke, and he is a little budding filmmaker here locally out of the Bloxburg area, and he is renting the Antique Depot building on Main Street. It's going to be a 2-weekend, I believe it's a 2-weekend, possibly a 3-weekend event just on the weekends. Some more information will be coming out about that. And whatever else is happening in downtown around Halloween, we'll keep everybody updated on that as well. Don't forget, tomorrow is the recall election, or the special election, however you want to call it. The Veterans Building next door is open for voting and early ballot drop off, or just drop off your ballot tomorrow. And then next week, our special guest will be our Parks and Recs director, Cameron Mull, who is going to give us an update on those grants that they're hoping to get to expand Newburgh Park, and what they're working on to bring a community pool to the area. So tune into that. That'll be a good meeting. And that's all I have, I think, for now. So I will turn it back to Bailey.
Thank you. I came to the office this morning and saw all those Halloween decorations across the street. I was very curious what's going on over there.
Yes, that's why I'm making a public announcement.
Yeah.
Otherwise, I was told to keep it quiet. But since he's out there now and he sent me his flyer, there's even a website. I'll put that link in the chat so people can check out his webpage. I mean, he's on it, so it's great. It's going to be fun, and they're really conscientious of COVID, and so they'll be spacing people out and encouraging family groups to stay together, and masks and the whole thing. So that's great.
Fun. Any other announcements from any of our guests with us today? No? Okay. Oh, Melissa.
I'll give you one.
Okay, thanks.
Burger Week's coming. And the insider's out. So Burger Week's the 24th through October 3rd. We have over 20 restaurants currently signed up. Lots in Fortuna already. Double D's. El Taco Loco's gonna have a burger. What else, Kyle?
You got Bob's.
Hot Deli, Bob's, Eel
Eel
River.
River.
Who? Anybody else?
Did you get Smoking Barrels yet?
Smoking Barrels? You guys need to go tell him to do it because he wants to know like who's doing it, how many are doing it, and like what his competition is, and like it's too much. But yeah, it's a great thing and exciting contest this year. We're doing 2 different contests. One is you take your Burger Week receipt, write your name and information on the back of it, go give it to my brother over at Eel Valley Appliance. He's giving away a chest freezer and $250 worth of groceries. Or go on Burger Week, ncjburgerweek.com, and you can enter to win a dinner and farm tour with the Foggy Bottoms boys. It's they're cooking burgers and doing some fun stuff. So yeah, get ready. Burger Week's crazy. That's all I got.
Melissa, where's the list of all the restaurants?
ncjburgerweek.com is where you're going to get it. I'm slowly adding stuff as it comes in. So it might change the restaurant information. It's very vague right now, but I got my photo this morning of Plaza Grill's burger.
Okay.
And it's just, you guys, it's just amazing how many people travel around the county and go all over the place for these burgers. So there's veggie burgers this year too, because people are mad. They don't want just the beef.
What's wrong with that picture? I was just gonna say beef, it's what's for burgers. So, you know, just saying.
But with Dr.
Arcidi, our heart doctor here, you know,
Yeah,
beef is good in moderation. I just have to push that.
Yep. So
probably not 20 burgers in a week though, I'm guessing, but
Moderation.
oh, sorry, I didn't mean to respond. I'm trying to put links in the chat and I private message, so sorry.
yep, that's my only news and some special news dropping this week. So that's it.
Okay, secret news we have to wait for, I guess. Yeah.
Secret news dropping this week.
Awesome. Thank you.
Okay.
Anybody else before we turn it over to our guest speaker? Nope. Okay. Well, Dr. Joseph, is it Arcidi? Is that, am I pronouncing that correct? Well, I'll let you take it over from here.
Super. All right. Becky, you'll just make sure that we get this started correctly. Do I click on my screen or just what do I do here?
Do the share screen.
Oh, yep, share screen. Okay.
And then just find your presentation.
And I go to the presentation. Great. And
Perfect. There you go. And then hit your play and you're good to go.
okay, let me get the meeting banner out of the way so I can see it here.
There you go. Oh, you're right there.
Good. All right, great.
There you go.
All right, folks. So I really just wanted to introduce folks to what I think is now our growing, vibrant program at Providence St. Joseph. And we've actually attracted a lot of attention, not just locally, but since we're part of Providence, I have meetings with the other Providence cardiac surgeons, not only in California, but also throughout their organization, which is heavy in Oregon and Washington State. And so we're doing some good things, and we wanted to share them with you all too. We think that you know, a real focus of our program is serving our community, but also really being state of the art. So what are the things that we do? This is kind of an animated model of a heart. certainly the most common operation that any cardiac surgeon does is still coronary bypass grafting. This schematic shows how a vein from the leg would be used to construct a bypass graft where you attach it to the aorta and then beyond a narrowed part of the coronary artery. And also it shows bypass grafts using arteries, in this instance from the chest wall or arm. And you'll see that that's something that our specialty is favoring more and more. And there's some emerging evidence that these lead to better long-term survival than just using one if we can use more than one. But frequently we'll still use veins from the leg. Heart valve repair replacement is certainly a specialty area of mine. This cutaway now shows some of the heart valves that are inside the heart rather than the coronary arteries that are on the surface of the heart. The aortic valve, which you're seeing basically in that kind of hidden view there, is a valve that we would generally replace. And we are more and more frequently using almost exclusively valve replacements for the aortic valve that not require blood thinning, but nothing more than a baby aspirin lifelong. The tricuspid valve is this valve shown on the right side of the heart. That's something we would repair. And mitral valve repair is something that I've been doing since I trained at the Cleveland Clinic and spent time in Paris back in the early 90s learning this. So it's something near and dear to me, and we've been doing a fair amount of mitral valve repairs, you'll see. Atrial fibrillation, which this is trying to show here, atrial fibrillation corrective surgery is something that was developed first in Washington University in St. Louis. You can kind of see a typical EKG of the irregular rhythm. And this involves these small pumping chambers on the top of the heart, but that's where atrial fibrillation, these circuits that form and break up continually, and that's what leads to these chambers, rather than beating, they just wiggle. I think everyone has heard the shorthand phrase, a fib. A problem with my heart could lead to a stroke in my brain. So that's one of the things that is something that I've actually, my background is actually quite academic, and so I've written frequently about the Mays operation. Let's see if that goes anywhere. Excuse me a second. So this is something that we are very excited about. We are in the stage of development of offering patients the ability to get started with a heart pump support. You know, we probably have a half a dozen or so patients a year that very sadly we lose at our center. They come to us extraordinarily ill and without any options and in dire straits, and they're too sick to even get to centers in UC Davis or the Bay Area. So I actually was an interim faculty member at Ohio State, and a very big center with transplantation and these type of heart pumps. So it's something that we're going to be, we're in the stages of development where we would be a center that will be able to salvage these patients by implanting these and then getting them to a center where more advanced therapeutics that our resources wouldn't allow. But these patients will be able to be saved and getting to that next phase of care. So it's something we're really quite excited about. So I've talked about our program being growing and vibrant, and these are some of the early achievements I did want to share with you. One of the things that we're pleased with is that in the operating room, we are transfusing less, and the green bar here shows basically a conglomerate of all the open heart surgery programs throughout the United States. We're all part of what's called the Society of Thoracic Surgeons, the STS National Database. And here at St. Joseph, we're pleased that our transfusion rate is significantly less than the national average. And this is actually all comers, not just coronary bypass grafting. Likewise, I intimated in one of the earlier slides how using more than one artery rather than just one artery and some veins is something that our organizations have been shooting for. And we're way ahead if you see the magenta bar there compared to the national average. In fact, there's a patient that I'm going to be likely using perhaps 3 artery bypasses on this week. So there's now emerging evidence that when we can use more arteries than just one, that there's actually a survival benefit. It's been something that's been hard to ferret out, but there's more and more emerging evidence from that. So we're proud to be doing this. It's something that I've been doing for a good number of years. This is something that we're really quite excited about, and I think Providence is very excited about it as well. Where we actually, I don't know if any of you all have had patients or family members or who relatives who've had heart surgery, and one of the things is they would typically come out of the operating room with a breathing tube that might stay in hours or perhaps even overnight. We're actually have advanced to the point where a good number, the majority of our patients are getting the breathing tube out in the operating room. And that's been a big benefit for the families as well as the patients. We find that they're actually more stable, and it's really nice to be able to tell a family member, well, their breathing tube is out, they're still groggy, but they're talking, and it's been something that we are been found to be able to do safely, and it's certainly way ahead in a sense of the numbers in our database. So those are some of the things I wanted to share with you in barcode form or bar graph form. We're pleased to be doing a lot of heart valve surgery for a small program. And typically the average heart surgeons would perform more aortic valve operations than mitral valves. And so the average surgeon in the United States it's been demonstrated that they would typically see 5 mitral valve cases in a year, and repairing half or less of those. We've actually performed now 5 mitral valve operations in October. There was one we replaced because she had a non-repairable situation, but we've really been very aggressive with mitral valve repair, and that's something that we're very pleased to be able to provide. Something I've been doing since 1994. So really, in summary, our goals are to provide state-of-the-art cardiac surgical care. I think some of these slides demonstrate some of our early progress. We really, however, know that our mission is to carry on the legacy that the sisters started so many decades ago, and to really serve our community in that way, something I feel near and dear about. So that's all I wanted to say. I think that I do want to get out the message that certainly COVID, obviously the form that we're having today is virtual because of things. We have seen in our center and other centers around the country have come to recognize that because of COVID, patients are tending to neglect their cardiac symptoms. They're fearful of coming to the hospital. We really want to encourage them not to bypass these symptoms, get to the hospital. We are typically seeing, or unfortunately seeing, sometimes patients who have more advanced problems because they were fearful of coming in early. So cardiac symptoms certainly are ones not to be neglected, even in the COVID era. In my office, actually, we see patients and we see their families as well. I'm not a big believer myself in the telemedicine kind of idea because I think things get missed. So I've certainly worked with a lot of the, obviously our cardiologists, but also a good number of the primary care providers, reaching as far south as Garberville and beyond, and up northward, even up as far as Crescent City. So we're pleased. I think I look forward to hopefully meeting a lot of you in a non-professional setting. But it's really a thrill to be here and we'll carry on the sisters' legacy, I think. Thanks so much.
Awesome. Thank you. Does
Questions?
anybody have any questions? Come on. Okay, I'll ask a question. I always have questions. And then Danny can go. Perfect. The arteries that you look for, like where's the most common location? Is it the leg? Like where do you pull them?
Great question. So, by the way, how do I get rid of this slide here now? I just hit the escape button.
Yeah.
And then I'll hit it again.
Yeah, we're not screen sharing, so I don't know if you just can't see us anymore.
Now I see you guys.
Okay.
So, it is a toss-up between, we'll typically always use one artery that's on the inside of the left chest wall. That's the standard, to use that on the front of the heart. But typically it's somewhat of a toss-up being where the second artery might be often from the left forearm. There's two arteries in the forearm, and most folks have hand circulation that would allow one of those to be taken out without any impairment of the hand and being used as a second one. Alternatively, the artery on the right side of the chest wall is frequently. So those are the two most common sites of a second artery. Great question.
Okay, Danny, you had your hand first, and then we'll go to Mike Losey.
Thank you. I've actually got 4 questions. 2 of them are related to COVID. What are the long-term impacts of COVID infection on cardiac health? And can you tell us about the impact of the local COVID surge on the scheduling of cardiac surgeries in our region?
I'm going to answer the second question first, because right now it has impacted us. In terms of doing elective procedures, it's harder to get them in periodically, and right now is one of those times because of the surge. So I have 2 or 3 patients that are stable enough to be outpatients, and so their elective procedures are being postponed. We keep in touch with them, but patients who come in the hospital with a heart attack, small or large, they get triaged. They don't get discharged. We follow the standard of care on that. We don't really know yet what the long-term cardiac implications are for COVID. I think it's a science that's still evolving, and there's really not a lot that's understood about that. I will say there some of the things that we're concerned about are thromboses, and I think there's an overlap with heart attacks that can occur in patients who already have underlying coronary disease or potentially develop it de novo. So we don't really know yet, frankly, even the numbers. We don't really know to some degree the denominator of it. And I think that even things like potential vaccine issues that are creeping up every now and then, the young people that can get pericarditis or myocarditis, it's still not something we have a great handle on. It's now become, I mean, I've seen a little more pericarditis than I expected to see. I can't say that it's absolutely related to COVID, but it's something that I always have to ask about. Great questions, though.
What's the depth of our cardiac surgery? How many other doctors are there besides you?
It's really all me. And I have folks that come in when I take some time off each month. And one of those has also been a cardiac surgeon for about the same amount of time that I have. He's been a brigadier general in the Army, and he's been coming frequently to St. Joe's for more than a decade. So that's Brigadier General Dr. Carl Adams, and I think he's well known to a number of folks in the community.
How long have you been here serving our community?
So I've been here, I came officially in January, but I started coming here about a year ago. And it's really been so amazing, a cardiac surgeon to be embraced every single week. Every week, someone will come up to me and just thank me for being here. Frankly, I think about it truthfully as this is what the good Lord got me well trained to do, so this is what I'm supposed to do. And you know, I was part of a recruitment video that St. Joe's put on, and truthfully, we're doing top-notch care in our hospital, which frankly we think about, you know, between Redwood and St. Joe's, we really think about ourselves as a regional medical center without perhaps that title in our name, because that's how we function. I think that that ECMO, that heart pump thing, is only one example of things that will be evolving. I think it's going to be a number of years before we get to do some of the transcatheter valve things that goes under the acronym TAVR. I think that'll be a little farther coming, but we're really doing some neat things.
Well, thanks for being here.
Sorry, I accidentally muted you, Dr. Arcidi. I was trying to unmute myself to tell Mike Losey he could ask a question. So just you'll have to unmute yourself again, Dr. Arcidi. Sorry.
Sure.
Thank you, Renee. Dr. Arcidi, thank you so much for being here today and giving us this presentation. Some great information. I kind of want to tee off of what Heck was asking about. Can you give us an idea of the number of surgeries of the type that you're speaking of, the heart surgeries at St. Joseph, say in a year?
Great question. So before the COVID surge in the last 6 weeks or so, we were on track, truly on track to be doubling our volume, to be coming close to 100 cases in a year. So I think that sidetracked us, but we had been doing consistently about 2 cases a week. So that's a big increase above what historically we've been doing.
And that currently you say is about 2 a week, or is that prior?
Prior to the COVID surge. The COVID surge has kind of put a damper on things and limited some of the number of cases that we're doing.
Thank you. And then you were talking about transfusing less that St. Joseph's is about 10% of the surgeries that you actually have transfusions versus.
There will be transfusions in the operating room. I think there's several phases of care, but that's already one area that our transfusion rate is less in. There's still some patients that may end up getting some blood post-operatively, but we're certainly exceeding the history of cardiac surgery at St. Joe's in that region.
And the less transfusions, that's important because of contamination or rejection.
I think that it's been recognized that there are direct and indirect consequences of transfusion. And I think that we know in general that risk of infection, risk of other, the blood bank has really always been fairly safe. And transfusion related viral infections are certainly being able to be screened fairly effectively. But when we can avoid, for instance, sensitizing patients who might need transplantations in the future, but I think that you hit on the biggest one is just decreasing infection risk has been one of the big advantages of that.
Thank you, Doctor.
You're welcome.
Annie, did you have a couple more questions? Okay.
One last, if you don't mind. So it really is phenomenal that you're here, and I can see why the community gets so excited. And thank you to St. Joseph Providence for investing the money. I mean, so many resources go in and around, just the specialist, and it's taken a lot of work. So thank you for being here. These folks here are business owners, community leaders. What can we do as business owners, community leaders to help bring more physicians like yourself to our community? I'm sure you've been asked that a million times. And two, are you part of the local CMA, and would you be willing to participate in local workforce development efforts with our high school and college kids to kind of inspire them about your career path?
Yes, I would. Now, you raise a great question. I actually was, my wife and I met in Southern California and got married in Los Angeles, but she had never been, nor had I been north of the Bay Area. So when we arrived a year ago, basically just on an interview trip, we were astounded at the beauty of the area, just totally unprepared. And I guess it's been recognized that recruiting to the area will attract a particular type of individual. For me, the attraction was the ability to help build a program. And for someone who's really most of his career has been in academics, I'm probably a little bit different from the primary care doctor or ER physician or et cetera, who comes because they can surf. It's, we've got a 9-year-old boy. We're happy to be in a place where we can raise our family. But one of the things that I think is a real plus for us is our family medicine residency. That is a combined effort of the Open Door Community Health System and St. Joe's. And I actually give them 2 lectures every year, and I've already given them just this last month about cardiac surgery. And the neat thing about that is we have, by virtue of that, since we have seen these, let's face it, they're kids compared to me, but we have the ability to see them over the course of their training and say, we'll pick the best 1 or 2 of people who would want to stay in our area. And because we treat them, I certainly treat them well, we know that they're going to be loyal to our health system. So yes, I'd love to be part of so I'm part of graduate medical education in that sense. I'm certainly interested in all the time supporting careers in medicine at a younger age. I think we're all excited about I think you all are probably aware of the huge grant that's going to happen at Humboldt State. And I think that's going to that's going to have spin-offs and indirect benefits for a hospital like ours, where we're connected certainly electronically, and I think that the aspects of technology can only be beneficial for a place like St. Joe's.
Thank you, Dr. Arcidi.
You're welcome. What's FBID? I'm sorry.
Fortuna Business Improvement District. Yes.
Oh, thank you.
Excellent. Any final questions? Okay, great. Thank you, Dr. Arcidi. It's been a pleasure having you and learning about what's happening in cardiology. It's fascinating. And a lot of it's over my head, but thank you.
Thanks, everybody.
Yeah, we appreciated having you, and everybody, we'll see you next week. Have a good week, and don't forget Friday ribbon cutting at Sequoia Gas. If you're around 12:30, we cut the ribbon, but you can pop in again between 12 and 1. All right, thanks everybody. We'll see you next week.
Thank you.
Bye.
Thank you, Doctor.
Bye.